Welcome back. Now, in this video, we'll directly start with the inspection part. We have already gone through this slide, right? The various headings, inspection. One by one, we'll go through the various headings that is required for a proper inspection of any patient who is presenting to us with a swelling. Okay, the first one is site. So, site or where the swelling is situated, this is having a very important role in various congenital swellings and other swellings. Let's go one by one, and we'll be precise enough to discuss the important points only. So, dermoid cysts, they are usually seen in midline of the body, anywhere in the midline. If swelling is there, always suspect a dermoid cyst, and this can be seen just by observing on inspection, or sometimes on the line of fusion of various embryonic processes involved during embryogenesis. So on the line of fusion or in the midline. If swelling is there, always suspect dermoid cyst. This is the importance of site. For example, if any swelling is present at the outer canthus of eye, it could be a dermoid cyst. Why? Because outer canthus of the eye is overlying a line of fusion between frontonasal process and maxillary process. Sometimes these dermoids could be there in the post-auricular area, known as post-auricular dermoid, behind the ear, and that is again overlying the line of fusion of mesodermal tissue forming the pinna, right? So midline or on the line of fusion of embryonic processes, any swelling, suspect dermoid cyst. And whenever we are inspecting this dermoid cyst, just visually record the vertical and horizontal extent of the swelling, and that we can confirm on palpation later on. So on inspection only observe, right? Then second important subheading is color. If the swelling is black in color, two possibilities are there. Either it could be benign nevus or melanoma, a skin malignancy, melanoma, or it could be benign nevus, a black swelling. Okay, if the swelling is red, it could be hemangioma, and especially the hemangioma, they could be arterial or venous. So if red swelling is there and without any history of trauma, without any history of fever, inflammatory pathology ruled out, so red swelling means arterial hemangioma. On the same note, if the swelling is purple, slightly purple in color, the diagnosis could be, one of the differential diagnoses could be venous hemangioma. Hemangioma related to the venous channel, purple color, having slightly deoxygenated blood. That's why this color. Whereas red, the arterial hemangioma, oxygenated blood is there. So red color, arterial hemangioma, purple color, venous hemangioma. Bluish color means ranula. Bluish color suggestive of ranula. Ranula is present in the floor of the mouth, right? So bluish color, ranula. So situation or site discussed, color of the swelling, okay. Then shape, size, and surface, 3S, okay. So shape, the options available, the swelling could be ovoid in shape, the pear shaped or kidney shaped. The swelling could be spherical or having an irregular shape. And these are the findings on inspection, right? We are not touching the patient, we are just observing, okay. So these are the various options available for a swelling. Plus sometimes the shape of the any swelling can help us to reach a diagnosis. So this is also important to know the shape of swelling on inspection. Then size, again in this inspection finding, sometimes the swelling shape along with the size we are just observing, and we can note down the vertical and horizontal dimensions. In this case, any patient presenting to us with a swelling, if we are having a measuring tape, we can know the vertical and horizontal dimension of the swelling, and obviously we are not palpating the patient, so we cannot comment over the deeper dimension of the swelling. At least we should record the vertical and horizontal dimension if we are having, or I should say we are supposed to have a measuring tape, right? Without touching the patient, without pressing it, just measure the vertical and horizontal dimension on inspection. Third dimension, the depth, obviously we cannot comment upon. So shape, size, and finally third S, surface. Few of the swellings, only by observing the surface of the swelling we can say, okay, this could be this. Like if the surface is just like similar to cauliflower, it could be a squamous cell carcinoma. Squamous cell carcinoma, cauliflower surface, everted edges. On inspection, it is looking like a cauliflower. If that is irregular branch surface, could be suggestive of papilloma. Again, a benign tumor, papilloma. After 3S, then comes the edge and then number. Edge, or also known as the margin. It could be clearly defined. The swelling may be having clearly defined edge, or may be having indistinct edge or margin. The swelling could be pedunculated, or it could be sessile. Pedunculated means a long stalk is there and swelling is a sort of hanging from that stalk joined to the body. And sessile means more or less the swelling is just nearer to the body surface, the origin tissue, that is sessile. There is no stalk, no hanging in sessile swellings, right? Indistinct means the edge is fused or the margin is almost indistinguishable with the surrounding structures, and clearly defined means obviously having a well-defined edge or margin. So these are the things we are supposed to see on inspection, edge inspection. Finally, the number. Number is also going to help us in reaching a diagnosis. Some swellings are there which are always multiple in number. For example, the diaphyseal achalasis, the neurofibromatosis (NFM), the multiple glandular swellings may be there, the multiple lymph nodes like Hodgkin's lymphoma or non-Hodgkin's lymphoma. So these swellings are usually multiple. Always means usually, always multiple, most of the time. Whereas at the same platform, some swellings are usually solitary. For example, dermoid cyst. For example, lipoma, a large lipoma, usually solitary. Usually word I'm using, it means most of the cases these are solitary, the lipoma, dermoid cyst. But yes, exceptions are there, right? So use the word usually. Neurofibromatosis, yes, we can say usually. These are multiple, and even we can say always multiple at different point of time. At a single point of time, patient may be presenting with a single swelling, but in subsequent course of time, he or she will develop multiple swellings in neurofibromatosis. Okay, having a congenital predisposition, this disease. And after number, then 2P, the peristalsis and pulsation. Peristalsis on inspection, if any swelling is associated with visible peristalsis, it could be congenital hypertrophic pyloric stenosis. There will be visible peristalsis on the abdominal area due to this congenital hypertrophic pyloric stenosis, or any swelling that is causing intestinal obstruction. There is usually visible peristalsis we are supposed to get on inspection, right? Then pulsation. The next important thing is pulsation. Peristalsis, then pulsation. Pulsation means obviously any swelling if that is arising from a vascular pedicle or arteries, let's say arteries, the swelling will be pulsatile. And examples are aneurysms and vascular growths. One of the example is carotid body tumor. So these vascular swellings, they are usually pulsatile. Important thing is the pulsation could be of two types. It could be transmitted pulsation or it could be expansile pulsation. In transmitted pulsation means the swelling is lying above the artery, not arising from it. The swelling is lying just by the side of some artery, or to be specific, it is situated above the artery. The underlying artery is pulsating, and that's why we are getting a transmitted pulsation on inspection. Vascular swelling, if vascular swelling is there, the swelling is arising from the artery, then we'll get expansile pulsation, right? So two types of pulsation, transmitted and expansile. Transmitted when lying above the artery, expansile when the swelling is arising from the artery. Then next important thing is impulse on cuffing. Very important for to rule out any hernia. Impulse on cuffing. So impulse on cuffing, the any swelling, if the swelling is in continuity with these cavities, we will get impulse on cuffing. For example, abdominal cavity. If swelling is there and that swelling is in communication with the abdominal cavity or peritoneal cavity, that like in hernia cases, abdominal hernia cases, So we are supposed to see the impulse on cuffing, right? Swelling in continuity with the pleural cavity also, or with the spinal canal, like spinal canal example like meningocele or meningomyelocele, and then cranial cavity, again the meningocele or sometimes encephalocele. So these cavities, if any swelling is in continuity with the abdominal cavity, pleural cavity, spinal canal, or cranial cavity, we are supposed to get impulse on cuffing. In adults, ask the patient to cough, and if the swelling shows impulse, it means the swelling is in continuity with the just discussed one of the cavity, right? In children, if the child is crying, no need to ask for cough or any other method. The crying will work as coughing, similar to that, right? After impulse on coughing, look for three movements: movements with respiration, movements on deglutition, and movements with protrusion of tongue, right? So movement with respiration. This movement is shown by swellings that is arising from the organs that is situated in the upper abdomen. For example, the liver, the spleen, these two are solid organs, and gallbladder, the stomach, hepatic and splenic flexures of transverse colon. These are hollow viscous organ, right? So if these organs are giving rise to some swelling, usually these swellings, they move on respiration, move with respiration. Then movement on deglutition. Movement on deglutition, any swelling, if fixed to larynx or trachea, it will move with the deglutition. The example is the thyroid swelling, thyroglossal cyst, subhyoid bursitis, pre or paratracheal lymph node enlargement. If these swellings are there, they will move on deglutition, right? Later on, we'll discuss these differential diagnoses, the various differentiating features between them in subsequent videos. For this discussion, just remember these are the various possibilities whenever a swelling is moving on deglutition. The thyroid swelling, thyroglossal cyst, subhyoid bursitis, pre or paratracheal lymph node enlargement, right? Then movement with protrusion of tongue. Swelling fixed to larynx or trachea, moves with deglutition, that is fine. But if the swelling is a thyroglossal cyst and it is related to the thyroglossal tract means some tract that is starting from the tongue, glossal part, the tongue, and reaching up to the thyroglossal tract. If that is there, thyroglossal cyst is there, it will move with protrusion of tongue, right? Then finally, the two important things remaining, the skin overswelling and the relation to the surrounding structures. So skin overswelling, if the swelling, overlying skin over the swelling is red and edematous, that is usually suggestive of inflammatory origin. If that is tense, glossy with venous prominence, the various vessels are there over the skin, over a swelling, it could be a mesenchymal tumor, that is sarcoma, having a fast growth. And if the swelling is having a black punctum a skin swelling, over a skin swelling, it is suggestive of sebaceous cyst, right? Pigmentation is there. Pigmentation of skin is seen in cases of moles, the various nevus, the various nevi, and if the patient is having repeated exposures to X-rays, then pigmentation of skin can be seen. Pyoderange, this is an appearance, especially in case of breast malignancy. The blockage of lymphatics draining the skin is there. And if there is any ulcer over the skin, over the swelling, it could be post-traumatic. And these ulcers can also be seen in cases of extensive malignancy involving the skin. Right? So these were the important findings on inspection over a swelling, inflammatory, sarcoma, the black punctum, that is sebaceous cyst, the various pigmentation of skin, pyoderange of appearance or the breast, in breast malignancy, ulcer on skin, could be post-traumatic, could be involvement by an extensive malignancy, right? Involvement of skin. Sometimes patient may be having scars. If the scar is puckered, broad and irregular, it could be suggestive of previous suppuration, right? And if sometimes patient may be having suture marks, linear suture marks, that is suggestive of previous operation, previous operative history will be there. And if the scar is regular, usually it is a healed scar post-traumatic, right? So these were the inspection findings we are supposed to look for during examination of any swelling. And finally, look for any pressure effect. Inspect the limb distal to the swelling. It is going to help us. Sometimes, if the patient is giving history suggestive of trauma, or due to any condition, if the patient is not using the limb, or he or she is not using the limb due to the previous trauma leading to the nerve injury, he or she will present with the wasting of distal limb. So, looking for the pressure effect, the various signs is very important. Wasting of distal limb could be there, or sometimes if there is some axillary swelling with edema of unilateral upper limb, it could be suggestive of lymph node involvement in the axilla. Look for the primary pathology in this case. The neck swelling is there with venous engorgement. Sometimes there may be retrosternal prolongation of swelling, as in the case of retrosternal thyroid or retrosternal goiter, and it gives rise to venous obstruction, the neck swelling with venous engorgement. So always consider the possibility of retrosternal extension of these swellings, right? And that is going to help us in the management of these type of patients. So that is all for this video, and we'll continue with the palpation part and further on, right? So till now we have discussed the inspection findings, the inspection points, and specific points we have discussed. Let's meet in the next video for palpation part. Thank you. Thank you once again.